I'm Dr. Henry Sardar. Today I will be demonstrating an ultrasound guided knee injection. Keep in mind that this is normally done using a sterile technique, using alcohol or betadine and prepping the area properly. But this will not be done for this demonstration. The first thing that I will do is examine the knee under ultrasound to find the suprapatellar bursa, which is the area that will be injected. We begin, of course, by placing the transducer just above the patient's patella. Next, in setting up for the injection, I'm going to rotate the transducer here where we can see the target site. As demonstrated on the machine, the suprapatellar bursa is located just superiorly to the patella. The proper landmark associated with the knee injection are located by palpating the iliotibial band, which is a structure that runs down the lateral thigh. Between the iliotibial band and the vastus lateralis, there is a soft spot, which is where the injection is done. The site will be marked and the area will be prepared for the injection that will be performed in a sterile fashion. Now the area is prepped and the patient is ready for injection. For demonstration purposes, I will be showing where the injection trajectory will be going. As you can see, right above the patellar at the soft spot, which what we call is an in-plane injection. And if you pay attention to the ultrasound machine, you will see that the tissue movement is consistent with the above the patellar, above the suprapatellar region. And that's it, and we're done. At this time, I would like to introduce you to the ultrasound equipment itself. In the past, many of the offices, particularly such as pain management and orthopedic offices, would do these injections blindly. However, especially with the advances in the ultrasound equipment as well as the portability of these ultrasound equipment, it has become much more common for these equipments to be used. In this particular case, I'm going to be demonstrating the Sonosite M Turbo. It does come in with an MSK, which is a musculoskeletal dedicated software that has something called MB, also specifically geared to help visualize the needle. With this particular machine, we do have two probes. One is what we call the HFL50, which is a linear probe that has a frequency ranging from 6 to 15 megahertz. Additionally, for deeper injections, we occasionally do use the curved probe, which is called the C60, and it comes in at 2 to 5 megahertz. Of course, when we do begin the examination, we begin with somewhat higher depth setting in order to first get the big picture, and then gradually decrease the depth when the target structure is found. The depth will be usually set between 2 to 3 centimeters. Of course, probe orientation is very important. Because of that, it's important that the physician performing these injections are familiar with a probe orientation. All transducers have an orientation marker that corresponds to the marker on the screen, which is demonstrated by the blue dot here.